Welcome everyone to the sixth webinar of this special series on alcohol policy in Canadian municipalities. My name is Tina and I will be introducing today's session. The topic of today's webinar is Municipal Alcohol Policy, Bridging Theory, Practice and Community Impact, a Saskatchewan example. So our presenters for today will introduce themselves at the start of their respective presentations. We will begin with the folks from the Northern Alcohol Strategy, and I would now invite Andrea to share their slides and to introduce themselves.
Good morning. I'm Joan Johnson, and I am presenting today along with my co-workers, Glenda Beauchamp and Andrea Cowan from the Northern Alcohol Strategy. Today, we're going to be explaining the Northern Alcohol Strategy, the power of community action, and the options for municipal bylaws in Saskatchewan. We've been doing this work since about 2016. It was inspired by my late husband, Harold Johnson, after his second brother was killed by a drunk driver in northern Saskatchewan. He wrote a book called Firewater, How Alcohol is Killing My Family and Yours. And that book really contained the changing the story messaging to stop the normalization of alcohol. We started to work in and for community to reduce alcohol harms, and we focused on the Lac La Ronge region. We eventually became part of the government of Saskatchewan's community safety and well-being to offer support across Saskatchewan and partnered with Sask Government Insurance and Sask Liquor and Gaming Authority. The Lac La Ronge project ended up evolving and we now support across Saskatchewan and Saskatchewan population level discussions. We can offer research data support, learning opportunities, partnership support, best practices information, and other assistance that communities may require. Okay. So in the very beginning, we learned that alcohol use should be seen as a spectrum. It's not just about being drunk or being sober. It's abstinence to severe alcohol use disorder. And there's evidence-based interventions all along that spectrum. We learned that best practices indicates communities that take a multifaceted approach to alcohol management, including prevention and awareness, pharmacological and treatment interventions, targeted community safety interventions, and pricing availability strategies are successful in decreasing the impacts of misuse. In addition to Sask Government Insurance and Sask Liquor and Gaming Authority, and I might say Canadian Institute of Substance Use Research, we've established a broad range of partnerships to support our work with best practices information, financial and human resource expertise, and data contributions that assist the provincial and local planning and put those plans into action. Glenda, over to you now. This is Glenda Beauchamp.
Thank you, everyone. Thanks, Joan. I'm just going to take us through some of that communities in action now. So Joan gave us a nice overview of the history of the Northern Alcohol Strategy. So this first slide we're sharing is the Lac La Ronge CAP, so the Community Alcohol Management Plan. It's a representation for the Tri-Communities area, so the town of La Ronge, the northern village of Ronge, and the Lac La Ronge Indian Band. So those three work together to address issues in the community. The camp itself has a number of representatives from a number of agencies and frontline service providers. So it's really a multi-sectoral approach to this committee. The camp works in a variety of ways and has been around for a number of years, like Joan mentioned. But some of the notable things that have happened over the years are really challenging that normalization of alcohol. So sparking conversations within that committee, and then broader conversations, including a promotion of alcohol-free family friendly events. So there's some ongoing community events in those communities that continue to grow and be successful in the absence of alcohol. There's also trainings that can be provided to communities, often involved in some data collection, and most recently one over the last year or so. And then also some support with bylaw implementation. So a very active camp, and they've been around for a number of years. The next is Prince Albert's Community Alcohol Strategy Steering Committee, so CASI as we know them. So their strategy focuses on 3 areas. So we work alongside them for, again, promoting those family-friendly events and alcohol-free activities. They recently hosted a mocktail challenge that was really well attended, winter fairs, community events, that sort of thing, which really promotes those alcohol-free activities. Encouraging safe and responsible consumption of alcohol when it's served. They run a taxi voucher campaign over the holiday season, which is also quite well received in the community, and intervention and treatment supports for those that need it. One other interesting activity that they undertake annually is the Liquor Bag Project. So we just wanted to share this one example of the work, of the many types of work that they do as a committee, and is the Liquor Bag Project. So the coordinator of that committee works with local retailers to get the blank bags, and works with the schools and the elementary schools to have students really decorate these bags in a meaningful way with some messaging for those that are purchasing alcohol. So those bags go back to the retailers once they're completed. So it's sort of a win-win where students in those elementary schools kind of start to have those conversations about impaired driving and the impacts that alcohol can have. And then those that receive the personalized message when they purchase alcohol, they kind of have this unique, one-of-a-kind bag that's come from a student who's written that very heartfelt message. And then each school does receive like a bit of an honorarium to host a party. So it used to be a pizza party at one time, but now they've moved to something a bit different, just a way for those kids to come together to celebrate the work that they've done. So we always like sharing some of those pictures. So lots of variety. So no 2 bags are the same. So it's a really great project that they carry on. The next one is the Creighton and Flin Flon Camp. So again, the Community Alcohol Management Committee. So some of the events that you see here in the pictures are a mocktail event. So they set up a table at the liquor retailers and do a variety of different mocktails for sort of, again, encouraging that conversation, looking at alcohol-free events, and just overall community engagement. So working with youth and the overall community on the impacts of alcohol. So again, really challenging that normalization of alcohol and starting those important conversations. And then the next piece of work that we have to support communities is we have a grant portal. So our Northern Alcohol Strategy Grant Portal, something new that we got off the ground this year. And it's intended for communities to support locally led initiatives or projects. It can be used for trainings or any sort of strategy planning around reducing harms from alcohol in the communities. So it's a new launch this year. We're excited to be able to offer community support that maybe aren't at a whole committee level, but if there's one-off initiatives that they're interested in using the money to support that event, we're happy for that. So for an example, if a community was interested in hosting a community event around National Addictions Awareness Week, we would encourage them to apply to this grant portal where we could offer some funding to support those community initiatives. So with that, I will hand it over to Andrea.
Awesome. Thanks, Glenda and Joan. I'm going to be digging a little bit more into some bylaw and policy options more specifically. So in addition to the work that Glenda and Joan mentioned around kind of ground level community projects initiatives, We also recognize that at that community level, there's a lot of options for bylaws, implementing bylaws that could have an impact on reducing alcohol harms. So 2 examples, we've offered support to both the Lac La Ronge and Prince Albert regions to implement bylaws around hour of sales. So with the provincial kind of level, I believe being from 8 a.m. till 3 a.m. for liquor retailers, 9:30, I want to say, until 2 a.m. for bars and taverns. Municipalities do have the option to implement a bylaw around hours of sale. So both in La Ronge and Prince Albert, that has happened. From our presentation, the city of Prince Albert is going to kind of follow up and be able to provide some information around the data tracking around their more newly implemented bylaws. So in La Ronge, that was 2019. Prince Albert, that's just last 2024, I believe. So in terms of what can municipalities do, when we work with municipalities that are interested in bylaw implementation, we'd say as initial steps, identifying some key stakeholders, assessing the community readiness, and offering educational resources to help understand jurisdictional responsibilities between what's kind of the authority of the province versus a municipality. We have some information from Caesar's Cape project up there. We really like this to demonstrate one of those educational resources is really understanding that kind of cost and revenue balance when it comes to alcohol. Often we see alcohol as a revenue generator, but really understanding the harms and therefore costs that are associated with alcohol can be a really beneficial kind of resource to offer. Leading discussions, so bringing in as many stakeholders as possible, including the naysayers who have important kind of opinions or concerns when it comes to bylaw implementation. I think I saw Laura Lee join the call, and I think some of on the right-hand side here, these are some from the conversation guide from Lloydminster around kind of what questions those conversations can have, and again bringing in neighboring municipalities, neighboring First Nations that might be impacted by a bylaw to hear their perspectives as well. When it comes to policy options, the first is that reducing the hours of sale, which has a really strong evidence base for reducing alcohol harms. Again, we're going to hear from the city in terms of what that's looked like in Prince Albert. Another policy option around determining alcohol use in public parks. So municipalities do have the option to determine designated spaces with specific hours where an alcohol can be consumed. I think that's a common one that kind of comes across the desk of elected officials to consider. There's also a policy option for municipality to control alcohol in kind of event setting spaces, and I think specifically municipal event spaces. So if your municipality has a community hall or a rink or an arena, considering that you can incentivize alcohol-free events by offering discounted venue rentals for community groups that might want to rent out the space. There's also the option of mandating serve it right. So if a community group is hosting an event and they have a special occasion permit to serve alcohol at that event, it's up to the liquor authority to determine whether or not serve it right is necessary based on the event. But a municipality can decide to mandate serve it right so that volunteers have the best access to kind of safe service information, as well as a policy option for limiting alcohol marketing or sponsorship in those spaces. I think especially youth spaces like rinks or arenas, wherein the promotion or advertising of alcohol could be considered. Measuring impact. So part of bringing in folks at the beginning of those conversations is also having allies when it comes to data collection. If you wanted to measure the impact of the bylaws, so multiple data partners means multiple data sources. And then really encouraging having a mechanism to communicate that back to your municipal government, back to the stakeholders involved, and to the broader community as well. And this slide we included really to show the loop or the circular motion of any community action, really, bylaws or otherwise, that after we kind of celebrate or evaluate, we can kind of go back to that first step and now ask ourselves, what can we do differently, or what can we do next based on what we're seeing. And that concludes things for us. We've got our email there for contact as well for follow-up.
Hi, everyone. I'm Jim Woodcock. I'm the Community Safety and Wellbeing Coordinator for the City of Prince Albert. On our call here with us is Lauren Rusk. She's a Senior Epidemiologist with the Sask Health Authority. Megan McConnell, she's a Master's of Public Health student with the University of Saskatchewan. Anna Dinsdale, she's the Community Safety and Wellbeing Manager for the City of Prince Albert. And available for the Q&A here is Dr. Ahmed Fares. He's a Medical Health Officer with the Sask Health Authority. So just an introduction about Prince Albert before we get into it. Prince Albert's a city in Treaty 6, and also kind of a long history with Métis. Just 45 minutes south of here's we're the site of Batoche. We're Saskatchewan's third largest city, so about 40,000 people, kind of, if you look at the census, located 130 kilometers north of Saskatoon. But we're a major service center for northern Saskatchewan due to our location. So we kind of, if you ask kind of anyone in this city about our retail population, it's usually more about 150,000. So that's kind of, in the city is 140,000 people, but we service kind of that 150,000 person population of northern Saskatchewan. And there's kind of two big facts about Prince Albert that set it apart from other places. City's approximately 50% First Nation and Métis, which is kind of the highest proportion for a city of its size in Canada. And we also have a very kind of young population. When you look at a population curve of most places in Canada, it's tended kind of aging, where Prince Albert has that kind of inverted pyramid where we're actually getting younger, which creates some kind of dynamics that a lot of the rest of the country doesn't have. So alcohol use in Prince Albert is pretty substantial. Average person in Prince Albert drinks about 15 alcoholic drinks per week, so that's people 16 and over, where the national or the provincial average is 12.6 and the national average is about 13.3. Between April and 2023 and June 2025, Prince Albert consumed an average of 1.6 million alcoholic drinks a month for, a place that isn't too big. But kind of the good news with that is that that's been on a steady down slope over that period. So it's kind of a problem that's getting a bit better. So kind of the impact of alcohol in Prince Albert. So kind of in the years preceding the bylaw, and we'll speak about the bylaw in a minute, but there's a few worrying statistics. So in 2023 to 2024, the rate of hospitalizations caused by alcohol in Prince Albert surpassed both the provincial and national averages. And in 2022, Prince Albert Police Service indicated that the majority of their arrests are linked to intoxication. And broadly, most of that's to alcohol or polysubstance, which includes alcohol. So kind of as such, there's a lot of consideration given as to what policies might be useful to mitigate alcohol-related harms. So I'll let Anna talk a bit about our policy window here in the bylaw.
Thanks, Jim. It's lovely to see so many people on the call. It's fair to say that a lot of this work has been underpinned. The key theme, both that you'll have heard from the Northern Alcohol Strategy and that you'll hear from us, is around partnership work. And before we started talking about the bylaw itself and the outcomes, we really wanted to explain how we had the right kind of factors in our community that meant that passing a bylaw was palatable. And so to fellow bureaucrats on the call, government folks who help to shape policy, you'll know how those policy windows are really important and how the community can work to create those opportunities. So The Northern Alcohol Strategy spoke about the bylaw in La Ronge, and that was in around 2019. And that was before SLGA's legislation changed. And at that time, the Community Alcohol Strategy Steering Group, so CASC, and we have Karen Anthony Burns on the call, so shout out to Karen because she's really driven that work for a lot of years, did approach City Council in Prince Albert and said, hey, La Ronge are doing this. Would Prince Albert do something similar? There was a slight difference. In La Ronge, they had one retailer, which was the SLGA retailer. But here in Prince Albert, we had a number of different retailers. And there was also a history of some litigation from retailers. So I think it's fair to say that administration and council were cautious about limiting hours of sale without that clarification in the legislation. And then thankfully, SLGA did clarify the added word in to clarify the ability of municipalities to be able to limit the hours of sale for alcohol. And at that point, CASC came back to council and said, hey, council, would you reconsider this? Now, I guess, so that's some of the kind of legislative and kind of community pieces. The other thing it's worth mentioning is that we also spent some time engaging with retailers previously. So we had a session with retailers to understand some of the unique challenges that they were experiencing. And then during the phase leading up to the bylaw, we undertook some really kind of structured consultation with retailers and businesses to get feedback. So really, there are a number of factors that created this perfect policy window for us. And that was the legislation, momentum from a community group. Jim's already spoken about the impact of alcohol in the community. And I think public intoxication was very high on the community members' agenda. And that also meant that there were businesses who previously would have been cautious about the municipality intervening to regulate business hours. Actually, there was this kind of division in businesses where some said, this might be a very good idea because it might help us economically. So really, those are a variety of factors that enabled us to make this change. Last but not least, and before I hand over to Megan, who was our wonderful practicum student and spearheaded a lot of this work, I would mention that for those on the call that are with municipalities, there is this conversation about what role can municipalities play in supporting the community safety and wellness. And there is a key role that they can play. And I think it's fair to say that we're very lucky here because the city has begun to really understand that role. So on that note, I'm going to hand over to Megan.
Awesome. Thank you so much, Anna. So it's been alluded to before, but to really describe what Prince Albert's bylaw was, it was the liquor store hours of sale bylaw, and this came into effect on June 1st, 2024. And what this bylaw did was it restricted the permitted hours of sale of liquor stores within Prince Albert to between 10 a.m. and 11 p.m. So previously, there was no municipal restrictions on when liquor stores could be operating within the city. So as per provincial regulations, some are open as early as 8 a.m. and others as late as 3 a.m. as per those regulations. But this bylaw was not implemented on its own. There was also the establishment of an alcohol monitoring table in partnership with city administration. And this was implemented in order to help scan for any unintended consequences that may have come from the bylaw. So while the bylaw was well backed by evidence to be effective at reducing alcohol-related harms in the community, there were concerns over the possibility of unintended consequences like an increase in presentations for alcohol withdrawal, or increases in foot traffic exiting the city if people were looking for alcohol when they couldn't find it within city limits. So as such, the alcohol monitoring table brought together representatives from the city police, the Saskatchewan Health Authority, Prince Albert RCMP, and the Prince Albert Fire Department in order to regularly meet and discuss any incident that may have arose within their respective jurisdictions that could have possibly been related to this bylaw. Partners from these agencies also collaborated in the evaluation of the bylaw, which began approximately 1 year after its implementation by providing data on indicators of alcohol-related harms from their respective jurisdictions. So while many indicators of the bylaw were assessed following its implementation, for the purposes of time, today we're only going to be discussing the evaluation of how emergency department visits to the Prince Albert Victoria Hospital may have been impacted by the bylaw's implementation. So what this emergency department assessment was it was a retrospective study completed as a collaboration between the Saskatchewan Health Authority and the University of Saskatchewan's Department of Academic Family Medicine, led by Dr. Jeffrey Irvine. So, after receiving an ethics exemption from the University of Saskatchewan's Research Ethics Board, this study compared data on emergency department presentations during the pre-bylaw period to that of the post-bylaw period, with the overall objective of assessing how the volume or proportion of emergency department visits to the PA Victoria Hospital may have been implemented or affected by the implementation of the bylaw. So for this study, there was two main data sources. The first came from records pulled from the National Ambulatory Care Reporting System, or NACRS, on the presentation of visits to the emergency department, which were linked to conditions wholly attributable to alcohol. So those were records that were having ICD-10 codes relating to conditions that could be directly linked back to alcohol consumption, such as alcohol poisoning or alcohol withdrawal. But in order to also capture those cases which might be partially or potentially linked to alcohol, a chart review project was also completed by a team of medical residents in the family medicine program, looking for any cases that had ICD-10 codes linked to those partially attributable cases. So an example of what that might be is assault or motor vehicle collision, where there's some indication that there could be alcohol involved, but it wasn't directly captured in the NACRS system. So for all records that were pulled, there was inclusion criteria of the patient needing to be 10 years of age or older with an address linked to Prince Albert or its two surrounding RMs, that being the Royal Municipality of Buckland and the Royal Municipality of Prince Albert. And if a patient appeared in the emergency department multiple times throughout the day, only their first visit was pulled and included in the data set. I'll now hand it over to Lauren to describe the results of this study.
Thanks, Megan. So first off, we're just going to start with a summary of some of the descriptive statistics that we completed for this data, starting off with demographics. So of the individuals who visited the ED at the Victoria Hospital for alcohol-related reasons between June 1st, 2023 and May 31st, 2025, 55% were male, and visits were most common among those aged 25 to 34 years, with 29% of visits, followed by those aged 25 to 44, which represented 20% of visits. And those demographic trends remained consistent between the pre and post policy change periods. And here we'll look at some of the temporal descriptors. So we noticed that alcohol-related ED visits were more common at night between 1800 and 6 a.m. and on weekends between Friday and Sunday, and that was also consistent throughout the entire study period. And then our last descriptor that we'll include in this presentation was just looking at the severity of conditions causing individuals to seek treatment at the ED for alcohol-related conditions. Visits were most commonly triaged as less urgent or urgent, representing 39.6% and 30.6% of visits, respectively. And then to really compare between the pre and post policy change period, we conducted an interrupted time series analysis using Poisson regression. So just to start, on average in the pre-policy change period, there were 27 visits to the ED per week by Prince Albert residents. And then in the post-policy change period, we saw that decrease to 22.7 visits per week. Similarly, the proportion of alcohol-related ED visits decreased from 7.6% in the pre-bylaw period to 6.1% in the post-policy change period. And then just on the previous slide, we can see the different variables that were included in our interrupted time series model. So looking at the time, which is the third variable there, we can see that that was significant with a p-value of 0.01. And basically that means that there was a pre-existing trend in the ED data prior to the policy change implementation. If we look at the variable above that for the period, we can see that that was also significant with a p-value of less than 0.01. And this means that there was a significant effect of the introduction of the bylaw. And if we go to the graph on the next slide, we can see a more visual representation of this. So each of the dots on this graph represents the number of visits during a week between June 1st, 2023 and May 31st, 2025, with the shaded gray area of the graph representing the post-policy change period. The black line represents the overall trend in our data that was observed, and the dotted red line represents the expected trend that we would see if the policy or bylaw change hadn't been implemented. So we can see that when the bylaw was implemented, there was a significant drop in the level of ED visits to the Victoria Hospital by residents of PA and the surrounding area. But we can see that there wasn't an effect on the overall increasing trend that we saw pre-bylaw. So we do see a significant drop, but we are still seeing that increasing trend. And that brings us to the end of our summary of the results. So I'll pass it over to Jim for the wrap up.
Thanks, Lauren. So we also kind of, with our report to council, we added in some additional indicators on top of the SHA data. So we looked at fire-related calls from our fire department, alcohol-related calls from our mobile crisis unit, and just to kind of gauge the effect on like consumption of alcohol in Prince Albert, we looked at Saskatchewan Liquor and Gaming Authority, so SLGA data from alcohol shipments to Prince Albert between June 2023 and May 2025. Kind of the summary we found out of those that there's a potential effect on the overall trend of fire calls in the city. This was a little muddy because we used a similar time series process, and the initial kind of round, we didn't see a difference in the trend, but our last 2 months of that period were historically high fire call months for the city. So kind of excluding those, actually looks like we found a bit of a reverse trend, which was good to see. There's a statistically significant drop of alcohol-related calls at the mobile crisis unit, kind of in the pre and post period that we looked at. However, we weren't able to pin that exactly to the bylaw date. And then kind of one of the most interesting things for me was that we didn't find a change in the pre-existing alcohol sales trends in Prince Albert. So we can get into this in the Q&A, but basically kind of for, the change in ED visits and fire calls and mobile crisis calls, we didn't kind of find a disruption in sales relevant to the kind of bylaw change, which I found really interesting. And maybe there's a few ways to interpret that, but just kind of neat that it wasn't the bylaw, didn't affect the overall retail of liquor in Prince Albert. So kind of the next steps we want to adopt here, so that the city itself adopt a consistent approach to alcohol through municipal alcohol strategy. So that could involve how events are handled at the city, whether the city serves liquor at its facilities and kind of approaches of that nature. Advocate to the province to create a provincial alcohol strategy, which could include indexing social referencing prices to inflation. So right now the SLGA does have social referencing, which is kind of one of the best practice approaches to kind of limiting problem drinking, but it hasn't kept up with inflation, so that needs to kind of change there. And then kind of we hope to spread this around to other communities in Saskatchewan or maybe across Canada, and use this as an example of something nice policy that is kind of cost neutral, but actually has a positive effect on the community.